hope I don't have a particular axe to grind, but I have to say I am influenced by the failure of animal experiments to come up with therapies to date. And when you think of the species differences, the biological differences between mice and men, and human beings, I should say, it's not surprising. We have been, I have been just as guilty as anybody. We have invested huge hopes in this, high hopes, and perhaps too high. And I think we have been somewhat naive in this. It's become a huge industry. It's clear that experiments in the mouse or the rat do not predict therapy. Otherwise, we'd be much further on than we are. That doesn't mean to say that using animal models and cellular models cannot give us fundamental insights into the mechanisms of neuronal damage. The problem is translating that insight, and we have gained enormous insight from those experiments. But translating that into therapy in the human beings is obviously far more complex than we originally assumed. Now, that may change, but I think, and here again, this is a personal perspective, my approach and that of my long-standing colleague, Dr. Gilbert Ben-Simon, with whom I'm working on our current trial on interleukin-2 in ALS, we've always felt that what we really need is an experimental medicine approach. That's the term I use, whereby we build in experiments to encompass biomarkers and understanding complex genetics, gene expression, and any technology that will throw light on the response to the agent that we are asking our patients to take in any given trial. And we've seen that with the trial of tofersen in SOD1, although it was on the face of it negative, there were certainly very important positive elements to that, and particularly the use of neurofilaments in CSF, which are indicative of a response, but clearly will need more data. But I think it's showing us the way, and I think that was a really crucial experiment, and no doubt we will hear more about that and other gene modification experiments in the future. So I think all those together give us a new approach. As I said, I call it an experimental medicine approach to clinical trials. It's easier said than done. It costs money. But in the end, it's the only way we may be able to avoid more failures, which, as you know, we've had for many years. I would have to say that even the successes like Darabone, etc., are nugatory. In my opinion, they are arguable. Sadly, because we'd all like to see new drugs. And I go back to Riluzole, the only one with a clear effect on survival is Riluzole. And we still don't know how that works. And that's a shame on us all.